All set. All set? All set. All right. It's 3:30. We're going to call the public hearing to order. Does Representative Zawistowski, Senator Berthel, Representative Walker, anything?
No, thank you, Madam Chair.
No, thank you. And I did straighten out with my aide the problem with my name being wrong. So
Okay,
anyway, thank you.
very good.
Tammy,
Right,
I still can't pronounce your name right after 10 years. So, Tammy.
Zawistowski.
No, I know. I'm joking.
Yeah.
Okay.
But it was still Nikki on the screen.
Oh, well, that's not good.
Yeah.
Sorry, Madam Chair.
So up first is going to be Julie Wilcox. Julie, 3 minutes. The floor is yours.
Yes, thank you. Good afternoon, Madam Chairs and distinguished members of the committee. My name is Julia Wilcox, Senior Public Policy and Division Advisor at the Connecticut Community Nonprofit Alliance. The Alliance is the statewide organization representing the nonprofit sector. Community nonprofits provide essential services to over 500,000 individuals in Connecticut every year and employ more than 118,000 residents, improving the quality of life in communities across the state. Thank you for the opportunity to testify this afternoon. The Alliance respectfully requests that you increase funding for community nonprofits by 5% after providing $50 million to health and human service providers that did not receive the DDS specific bonus funds in the fiscal year 24 budget, a total increase of $186 million. The increases that the committee fought to provide in the past few years were deeply appreciated. However, those increases were just the start of a long-term effort to compensate for historically inadequate funding. Since 2007, factoring in the increases, nonprofit providers are still 32% behind. For example, while last year providers received a 2.5% increase on state contracts, just last month the minimum wage was increased by 4.6%, so that even with that increase, they lost ground. As you're aware, the governor's budget proposes flat funding for nonprofit providers, and I'd like to provide just one example of how this impacts the Community Justice Network. DOC is currently in the process of securing 2-year contract extensions for providers. In lieu of additional funding, many are faced with the reality that they must request to reduce aspects of their services or consider ending their contracts altogether. Providers are grateful for the collaborative relationships that we have with our state agency partners and appreciate that they must operate within the budget that they are appropriated. However, without funding increases, the essential services they provide are at risk. You have my detailed written testimony, and I'd like to focus on just a few key points, if I may. First and foremost, nonprofits are currently serving approximately 3,000 returning citizens in programs funded by DOC and thousands more which are funded by the judicial branch. Second, as we continue to shift towards serving more people in the community, it's critical that the budget reflects that the increasingly complex needs of this population, and these needs are outlined in my testimony. And finally, this morning, Representative Walker and Representative Candelaria initiated a discussion with Commissioner Quiros around the reinvestment of cost savings related to prison closures. And I'd like to just point out that my testimony includes information regarding savings from the prison closures since 2022, now a combined $26 million annually. And as Michael Regan explained from DOC, these funds were swept back into the general fund. And we look forward to reviewing the data that Representative Porter requested. And with that, I will end there with a most sincere thank you for your ongoing support and commitment to these critical issues. Thank you, Madam Chair.
Thank you very much. I'm glad you tied in how this fit into judicial and corrections. Appreciated that. Any
Thanks
comments or questions? Seeing none. Up next is Jacob DeGennaro. Is he there?
He's not on, Madam Chair.
Okay. Up next is Michael Darby. Mr. Darby, you just have to unmute yourself. You are muted.
We go. Can you hear me?
Yep,
Thank
we
you.
can hear you. 3 minutes. The floor is yours.
All right, thank you. This afternoon, this statement is being submitted in support of the budget proposed by the probate court administrator to the state of Connecticut for fiscal year ending June 30, 2025. I have had the privilege of serving as the probate judge for the Greater Manchester Probate District, which covers the towns of Manchester, Bolton, Andover, and Columbia, for 13 years, and I am currently the first vice president of the Connecticut Probate Assembly. Although I practiced law in Manchester for many years prior to becoming a probate judge, it wasn't until I was elected judge in 2009 that I fully appreciated the wide range, breadth, and importance of the work done by the Connecticut probate courts. Probate court is widely known for probating the estates of decedents, of course. Often this may seem like more of an administrative procedure, but it is necessary to ensure that the taxes and other debts of a decedent are paid and the remaining assets are distributed to the appropriate heirs and beneficiaries. On occasion, however, a decedent's estate can become highly contested, be it because of disagreements amongst heirs, often family members, or due to claims by creditors that are disputed. These can become quite contentious and require no small amount of time and effort to resolve. They become very important to the litigants, with emotions often running very, very high, and we strive to let each of them be heard. While most of you are certainly probably aware of estates matters, it is the other matters that the probate court handles that I would like to emphasize today. Our courts handle a high volume of conservatorships. These are sensitive matters in which the rights of a person to make his or her own decisions are restricted or removed due to significant illness or impairment, such as mental health condition, intellectual disability, or physical challenge. Conservatorships can be contentious and difficult for all involved, and they're not done lightly. We strive to be sure they're absolutely necessary. Who amongst us is not familiar with someone who is vulnerable, having been taken advantage of by unscrupulous persons, be it on the phone, on the internet, or in person? We also hear cases about people who can no longer feed or care for themselves. We handle civil commitments, psychiatric commitments for persons suffering from serious mental illness. Making the decision to commit someone to Connecticut Valley Hospital for necessary treatment is not a decision to be made lightly, nor are decisions regarding other involuntary psychiatric treatments. We hear children's matters, including the removal of parents as guardians for their children, and even the complete and permanent termination of parental rights when a child is neglected, abused, or abandoned. It is frequently grandparents, uncles, or aunts who step up if they are indigent, and if they are indigent, they may be eligible for kinship and respite grants funded through the critical financial support of the general fund appropriation. This is not an exhaustive list, but it gives you a picture of the important personal, emotional, and sensitive matters that we handle every day. To do these things, it takes time, money, and staffing. Our clerks are asked to wear many hats and interface with the members of the public at times when they are upset and not at their best. They can be scared, confused, and frustrated. Probate staff not only offer a compassionate ear, but also guidance through the probate processes. Probate courts are often called the people's courts because they provide simple, direct access to legal proceedings, and they are conveniently located in regional courthouses and conduct business in an informal but professional setting, and have more affordable filing fees, including fee waivers when married. I ask you to restore the $5 million cut from probate in the governor's proposed fiscal year budget adjustments, and to approve the probate court administrator's budget as submitted. The legal and technical support needed to run our courts is wide-ranging and necessary, and the probate courts work hard to meet the critical needs of our state's most vulnerable residents. We ensure they have access to the courts, even if indigent, by granting fee waivers. The elimination of court filing fees for name changes also have us covering a loss of more than $650,000 a year. If you have any questions, I urge you to talk to the judge in your district. I think you'll find them be interested and willing to discuss these issues in more detail. Thank you for your consideration, and I promise we'll be good stewards of this money should you decide to accept it.
Thank you, Judge. Are there any questions for the judge? Seeing none, sir, you're all set. Up
Thank
next
you.
is Marty Isaac. Mr. Isaac?
Hi, good afternoon, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Marty Isaac, and I'm a longtime board member and advocate of Connecticut Against Gun Violence. I'm here testifying in support for the $4.9 million in the Judicial Department to fund Project Longevity, as proposed in the governor's budget adjustments for fiscal year 2025, a program that effectively prevents community gun violence. For those of you not familiar with Project Longevity, it's a program based on the concept of focused deterrence and group accountability, and it is remarkably effective. The program was launched in 2012, and since that time, up until COVID, gun homicides in our major cities decreased dramatically. The increase during COVID, to some degree, demonstrates the effectiveness of the program, and I will expand upon this point shortly. Project Longevity is based on the group violence reduction strategy developed by the Center for Crime Prevention and Control at John Jay College of Criminal Justice in New York. The research behind the strategy found that violence in troubled neighborhoods is caused predominantly by a small number of people, typically less than 0.5% of a city's population in specific identifiable groups. Project Longevity has shown that violence can be reduced dramatically when community members and law enforcement join together to directly engage with these violent groups. The data here in Connecticut and studies, which I have included in the appendix to my testimony, back this up. A critical component of Project Longevity is the call-in, a face-to-face meeting where partners engage group members and deliver a three-part message. First, that group members are part of a community, that gun violence is unacceptable and the community needs it to end. Second, that help is available to all who will accept it. Social service providers are standing by to assist with educational, employment, housing, medical, mental health, and other needs. And third, that any future violence will be met with clear and certain consequences. The next time a homicide is traced to any member of a violent group, all members of that group will receive comprehensive law enforcement attention to all crimes and any of its members are committing. As these rules become understood by the neighborhood, behavior changes swiftly. Rapid reduction in crime is not unique to Connecticut. Other cities have implemented focused deterrence programs and obtained similar results. What happens if funding is not maintained? We don't have to guess. The increase in shootings across many cities during 2021 and 2022 correlates directly with the inability of focused deterrence programs to operate effectively because of the pandemic. The city of Chicago, many years prior to the pandemic, provides even stronger causal data. Funding for their version of focused deterrence, ceasefire, was severely curtailed. The aftermath was brutal and predictable. Following a suspension of almost all ceasefire funding in March of 2015, only one of Chicago's 22 police districts experienced a reduction in shootings that year, the one in which ceasefire maintained its full program of operations. I recognize Connecticut has abundant budgetary challenges. However, aside from the moral imperative to reduce gun violence, it is also a fiscally prudent strategy. According to the Giffords Law Center, it's estimated that gun violence costs Connecticut taxpayers between $60 million and $90 million annually. The strong gun laws we have here in Connecticut keep guns out of the hands of dangerous people and are necessary, but not sufficient. That's why community-based anti-violence programs like Project Longevity are so important. I hope very much you will maintain that $4.9 million in the Judicial Department to fund Project Longevity, and thank you for giving me the time to share my thoughts with the committee.
Thank you very much, Marty. Are there any comments or questions? Seeing none, you're all set. Up next is Dr. Leslie Bumpus.
Thank you.
Dr. Bumpus.
Madam Chair,
Thank-
before we have Dr. Bumpus, excuse me, if I could just make an announcement that we do have an American Sign Language interpreter who has joined us for anyone who has that need.
Thank
So,
you very much. Thank you.
Thank you.
Appreciate that. That's our money in action. We all advocated for that last year to make sure that we had interpreters here. So I think that that's really important. Thank you, Madam Administrator. Dr. Bumpus, the floor is yours. 3 minutes, ma'am.
Yes, thank you for that inclusivity. Good afternoon, Senator Austin, Representative Walker, Senator Winfield, Representative Candelaria, and all members of the Appropriations Committee. My name is Dr. Leslie Bumpus, and I'm the lead dentist at York Correctional Institution, and that's the only women's facility in the state of Connecticut. I've been with the Department of Corrections going on 5 years now, and I'm also a public health graduate student at the University of Connecticut with a primary focus on oral health disparities and disability services, and a District 1199 New England Executive Board member and delegate. As a dentist, I treat infection, relieve dental pain, diagnose disease, restore mouths back to health, and educate individuals on oral health and disease prevention. I'm proud of the work I do. However, all of our dental staff are severely underpaid compared to the private sector in several other states. Low pay makes it nearly impossible to recruit and retain oral health practitioners to work for the state. There are over 850 incarcerated women, and I am the only dentist in the facility. In this state, there are over 10,000 incarcerated individuals with high dental needs due to many factors, including drug addiction, poverty, and insufficient access to oral health care services. Public Act 22-133 requires a plan for dental professionals to offer dental screenings to each offender and develop a dental care plan within 1 year of intake, then annually thereafter. Oral health professionals at DOC would love to provide these services, but the high acuity and dental need of each individual, along with insufficient staffing levels, makes this impossible. A simple filling diagnosed a year ago eventually turns into a tooth extraction because we're constantly putting out fires and are only able to treat emergency pain and infections. To have the capacity to actually provide quality care, the number of dentists, dental assistants, and dental hygienists must be increased by 34. To fulfill the need of Public Act 22-133, we need adequate staffing, space, and funding. The continued short staffing will lead to foreseeable harm to our patients as there's just not enough space or staff to treat everyone in a timely manner. The state has a responsibility to provide equitable health services for our patients. Inadequate staffing levels will perpetuate health disparities. We have the resources to do whatever it takes to recruit quality healthcare staff, but this is simply not being done. To address years of systemic understaffing of inmate medical services, expand access, and improve the quality of healthcare and mental health care services for the incarcerated, the increased funding given in the governor's budget must be allocated to the DOC healthcare line item. But if we really want to give our patients the care that they deserve, we must allocate $30 million for recruitment and retention of healthcare staff across all state agencies, including DOC. Access to healthcare is a human right that we must invest in, especially in one of the richest states in the country with a very large budget surplus. Thank you for your time.
Thank you. Hold on 1 minute now. Kat, can you let me know, are you all set? Are you able to keep up with all of this?
I'm doing okay. That was pretty quick, but I think I got it.
Okay, great, thank you. No questions for Dr. Bumpus. Thank you very much, ma'am. Up next is Tara Volpe. Tara, how do you say your last name?
Thank
Volpe?
you for, it's Volpe, yeah.
Sorry about that. I've known you forever, but
It's okay. It's like Madonna, like just Tara. It's all good. So I'm under the 3 minutes if I read quickly. If I slow my cadence to accommodate the person doing sign language, it may be easier for her. Do you want me to slow down or do you want?
Yeah, just slow down a bit. I want to make sure that she gets it.
Okay, thank you so much. Okay. Distinguished members of the Appropriations Committee, my name is Tara Volpe. I am the Director of Community Outreach for Connecticut Against Gun Violence. I'm testifying today in support of the $4.9 million to fund Project Longevity that's included in the governor's 2025 budget adjustment for the Judicial Department. My friends and colleagues from CAGV will tell you about how Project Longevity works and statistics that illustrate the effectiveness of this program, but I'm going to tell you a story about my friend Marcus. When Marcus was in his late 20s, he was living in one of our Connecticut cities, and one night he and a couple of friends committed a crime using a firearm, and they were eventually arrested. When he was in court, Marcus was given 2 options by the judge, jail or Project Longevity. Marcus chose Project Longevity. One of the first and necessary services the program assessed that he needed to succeed was moving far enough away from the city where he was living to help him avoid being pulled back into dangerous behaviors, but close enough that he could still have access to his family. And that's exactly what happened. Project Longevity provided Marcus with housing in another city in Connecticut so he could have a fresh start while not being completely severed from his family. Among other things like social and emotional support, Project Longevity found Marcus a job, and eventually they helped him graduate from college with a degree in social work. By every measure, Marcus is a phenomenal human being, and I am lucky to know him. But like so many young people living in our cities, he was faced with too few opportunities and supports for him to understand his own strengths and natural gifts. And that was a big part of the problem. Frankly, if Connecticut is ever to fully eradicate community gun violence, the state has a lot of work to do. So none of its children living in urban settings continue to experience this kind of hopelessness. Through services and supports, Project Longevity was not only able to help Marcus see a different kind of life, but he is now reaching his full potential. There is a strong possibility that Marcus, who is now in his mid-20s, would either be dead or in jail at this point had Project Longevity not been an option for him. And if you knew him, you would understand what an absolute waste and tragedy that would have been. Connecticut will now be a better place because of the path he chose, which was Project Longevity. There are a mix of direct violence prevention program models in our Connecticut cities. This is because this is not a one-size-fits-all solution. All of these effective program models deserve consistent funding and predictable funding. Project Longevity is one of those effective program models. We are so grateful to the governor for the continued support of this program, funding for this program in his proposal adjustment for the 2025, and we ask that it stay fully intact so Project Longevity is supported and can continue its work. Thank you.
Thank you very much, Tara. Any comments or questions for Tara? Seeing none, we don't have 7, 8, 9, or 10, so we're up to 11. Gail Wiggins. Gail, the floor is yours. 3 minutes.
Madam Chair, before Gail begins, I also want you to know that we have a Spanish language interpreter as well.
Thank you very much.
Just joined as well. We keep trying to promote her, so hopefully she'll accept the promotion. Thank you.
Okay. Gail, the floor is yours.
Thank you. Good afternoon, Senator Austin, Representative Walker, Senator Winfield, Representative Candelaria, and members of the committee. My name is Gail Wiggins, and I'm a licensed professional counselor with the Department of Corrections. Most of my career, I worked with victims of domestic violence. I realized, though, from the beginning to truly end violence of any kind, the perpetrator of that violence needed to be rehabilitated. I began to work with offenders in the community, and what I found was most perpetrators experience significant trauma themselves, often being exposed to domestic violence, community violence, and sexual violence as children. I then transitioned to the Department of Corrections with that same passion of treating the offender. I'm here today asking that you fund DOC Healthcare an additional $14.3 million for 175 positions with Department of Corrections so we can fund the clinical positions we need at Garner to safely and effectively manage care. At Garner, all the inmates have serious mental illness. Working at Garner can be considered the equivalent of working in a high-security psychiatric hospital. Some of these patients have murdered or significantly hurt someone because of the voices that they heard, or because they believed someone was trying to hurt them in some way, whether it be by poisoning their food or the medication that is administered to help them to be able to tell the difference between what is real and what is not. The inability to tell the difference between what is real and what is not is psychosis. Patients often can have delusions about mental health, medical, and correction staff that will put them in danger. And these patients believe their delusions, just like you believe that brushing your teeth every day will decrease the amount of cavities that you have, or just like you believe when you go to bed at night, you'll wake up in the morning. There was one gentleman on my block, the unit that I work, who was extremely assaultive to staff and other peers. this gentleman would also significantly injure himself. Sometimes he would cut himself so deeply that he would have to be hospitalized. This man was chained to the radiator as a child and sexually abused by his mother's boyfriend. The world, in his mind, is not a safe place, and no one is safe, and there's no one that he can trust. There's also another young gentleman who is on my unit who can become extremely emotionally dysregulated and assaultive. He often has flashbacks or nightmares about his childhood when he was a child soldier in a third world country. He once told me a story about being in a battle with his brother. His brother was wounded and he had to carry him over his shoulders on his back. He talked with him the whole time and he was walking. However, his brother became so heavy and that he had to sit down. And while he was talking to him sitting down, he realized his brother was not responding because he was dead. He told me he had to put him down right where they were and cover him up with leaves because he needed to keep going. He was 12 years old. Again, the world is not safe for this young man.
Gail, can you wrap it up, please? I'm sorry.
Yep, treating these individuals is essential to develop healthy coping skills, healthy ways to self-regulate, and they become emotionally overwhelmed and hopefully provide safety in the context of a therapeutic relationship. Nevertheless, this is a dangerous environment, and on the unit, Garner can have anywhere from 65 to 80 individuals who are symptomatic and have the potential to hurt themselves or someone else. Anytime during recreation or child, there could be a staff assault or a fight between peers on the unit and potential for serious injury and even death. Garner had 3 completed suicides last year within a 3-month time frame. There are times when individuals become so paranoid they stop eating and they starve themselves. We've had clients have to go to the hospital because they were starving and paranoid that their food was being poisoned. The role of the licensed mental health counselor is essential on these units, and there is a need for at least 4 clinicians per unit and administrative staff to assist with medication panels. Often, Garner must medicate patients against their will because they do not have any insight into their mental illness and will not take that medication. They so
Gail, you're
desperately
gonna have
need.
to wrap up now. You've gone well beyond the 3 minutes, and I can't let you go if I'm not letting others go. Apologize for that.
Okay.
Your story.
Okay, I apologize. I will read the last paragraph. So today we are asking the Appropriations Committee to fund the clinical positions we need at Garner to safely and effectively manage this often misplaced, forgotten, and dangerous population. Thank you in advance for making this a priority. Thank you.
Gail, I appreciate your comments. I've visited Garner. I know how it can be. So thank you very much. Are there any comments or questions? Seeing none. Thank you very much. Yes, ma'am.
Yes, we have a little housekeeping issue. We have 3 panelists, number 15, Kareem Davis, number 17, Crystalline Bates, and number 18, Shonda Brooks, who are declining the promotion to panelist. And they need to please accept the promotion to panelist in order to speak. Thank you, Madam Chair.
Thank you. Thank you, Gail, very much. Appreciate it.
Thank you.
We'll read your testimony. We don't have 12 here, so up next is Thomas Lally, number 13.
Good afternoon. My name is Thomas Lally. I'm a registered nurse with the Department of Corrections. I've worked for the department for over 13 years. During my career, I have held several roles and worked in many of our facilities. I currently work at Garner Correctional Institute in Newtown, Connecticut, the only men's mental health correctional facility in the state. We house and care for incarcerated individuals with severe mental illness. I am testifying today because although Governor Lamont's budget proposal is much better than it has been in previous years, it still does not provide enough funding for my colleagues and I to perform our basic functions. People are suffering. Without additional resources, they will continue to do so. Although this is a budgetary hearing, the heart of the matter set before you today is one of morals and ethics. The impact of the decisions you make will have real-world consequences for real people. Today is your opportunity to put your money where your mouth is and expand services to save lives. Incarcerated individuals are not able to coordinate their own care. They have to accept what you, as legislators, provide them. My colleagues and I can only provide care with what you appropriate for us. Despite our efforts and intentions, we are impeded by a lack of resources. The conditions at Garner Correctional are appalling. We are underfunded, understaffed, and overcrowded, the consequences of which are an increase in violence, a growing unrest, and inadequate care for the population. We are supposed to be providing care that is up to the community standard, but without the resources to do so, it is an impossible task. We need basic resources in order to provide basic care for the individuals in our charge. We need funding for 175 more positions, equivalent to $14.3 million more dollars, because our staff to patient ratios are below any known standard. Imagine a setting where one nurse is expected to care for nearly 200 patients with significant mental illness. Come take a job at Garner on third shift and you won't have to imagine it. We need space to do our jobs. Our mental health infirmaries are literally overflowing. As a result, individuals with severe mental illness are forced to sleep on the floor of a holding cell outside of the infirmary. There's a lack of space to provide meaningful care. We also need funding for equipment, training, and salaries. These are items I elaborated on in my written testimony, which I hope you will read. But due to time constraints, I am forced to be terse. My peers, colleagues, coworkers, and I are doing everything we can personally. But without your support, we are losing the battle. For all that, we can at least tap out, quit, and find another job, as many are. The people suffering the most by your decisions are the ones who cannot run out of there, incarcerated individuals. They don't have a choice in the matter. They endure whatever subpar care you appropriate for them. Again, this is a moral and ethical issue more than a financial one. The question before you today is, will you rise to the occasion and act in a morally and ethically responsible way, or will you continue to ignore a growing crisis? I implore you to please fund the Department of Correction Health Service Unit in a meaningful and morally sound way. Thank you for your time and attention.
Thank you very much, Thomas. Are there any comments or questions? Seeing none. You're all set, sir. Up next is, we are missing 14. 15 is Kareem Davis. Kareem, the floor is yours. 3 minutes. I think you are muted, sir. Kareem Davis.
Can you hear
Mr.
me?
Davis, there you go. Yep. Go ahead, sir.
Good afternoon to the committee. My name is Kareem Davis. I am a juvenile detention officer at Hartford Juvenile Detention. I've been there for 11 years. It is not uncommon for Hartford Juvenile Detention Center for it not to be enough staff to provide services that we proudly carry out. This is leading to employees being mandated into work, which drives up overtime and increased stress on staff. The service we provide is critical to the judicial branch. We should not have to worry about working doubles, being mandated, and which takes time away from our personal lives. Instead of increasing overtime costs, the branch should hire more juvenile detention officers so that the branch is adequately staffed. The shortage of staffing has also resulted in fewer lead juvenile detention officers that needed to be trained new staff that gets hired. Without adequate training, we are leaving employees on their own under-resourced. I urge the committee to add staffing positions to judicial branch to address short staffing crisis so that we can better provide service to the public. Thank you.
Thank you very much, Mr. Davis. Are there any comments or questions? Seeing none, you're all set. Up next is number 16, Isabel Pizarro. Isabel?
Distinguished members of the Appropriations Committee, my name is Isabel Pizarro. I'm a high school student in New Haven, and I'm the president of Connecticut Against Gun Violence Youth Council.
Isabel,
Oh, yep.
we have somebody that is doing sign language, so if you could speak up a little bit and slow your cadence down just a tad.
Okay, sorry. Should I restart?
Sure, go ahead.
Okay. Distinguished members of the Appropriations Committee, my name is Isabel Pizarro. I'm a high school student in New Haven, and I'm the president of Connecticut Against Gun Violence Youth Council. I'm testifying in support of the $4.9 million in the Judicial Department to fund Project Longevity, as proposed in the governor's budget adjustments for fiscal year 2025. Project Longevity is a group violence intervention program designed to reduce gun violence in Connecticut's urban areas. Decades of research have demonstrated that similar programs around the nation are very effective in reducing shootings and gun fatalities. I also support Judicial Department funding for other programs aimed at reducing youth violence, including the Youth Violence Initiative and Youth Services Prevention. Our country has a huge mass incarceration problem, which affects predominantly our Black communities. Project Longevity aims to prevent the systems that have targeted our Black, Brown, and Latino communities throughout history from continuing by supporting individuals rather than perpetuating the cycles that leave urban communities and families at a disadvantage. These types of efforts deserve attention and funding in order to be successful, which is why I and the rest of Connecticut Against Gun Violence Action Team and Youth Council are pleased that this funding has been set aside for Project Longevity, and we hope that it stays the same throughout session. Thank you.
Thank you very much, Isabel. Is there any comments or questions for Isabel? Seeing none, you are all set, Pam. Up next is number 17, Crystalline Bates. Crystalline, the floor is yours.
Hello, everyone. My name is Dr. Bates, and I'm a physician with the Department of Corrections. I am before you today to address a critical issue that affects not only the incarcerated population, but our entire community's safety and well-being. First, there is an additional need for funding for the budget to give into DOC healthcare medical staffing within our correctional facilities. We need to ensure that the proper funding is given prior so that we don't have to pay more out of pocket for overtime and mandatory overtime that is preventing our healthcare workers from going back to their families at the end of a shift. Secondly, we must address the stark reality facing many incarcerated individuals that they are arriving to our facilities more sick, more starved, and more ill than ever before. As a harsh reality, many individuals I care for have multiple nutritional deficiencies, massive wounds, serious infections, and complex withdrawal syndromes that complicate their ability to reintegrate into our community and within their families. We must invest in recruiting qualified medical professionals and counselors to address the pressing basic necessities for these individuals. In addition, more accessible and comprehensive programming is vital for creating safer and healthier family and community dynamics. For example, while breastfeeding is a human right protected by both the federal government and the state of Connecticut, under our current policy, new mothers are still not allowed to directly breastfeed their children while incarcerated. This has significant ramifications, not only just for the health of the mothers on an individual and biochemical way, but on a societal level, as strengthening the parent-child bond has a dramatic impact on reducing reincarceration rates, as well as long-term outcomes for the children themselves. Healthy bonds with caregivers has a direct impact on the likelihood that those children will end up in prison themselves. To be clear, proper medical staffing and budget allocation isn't just essential for addressing the current healthcare requirements of our system, it's also crucial for successful reintegration into our society. Without adequate medical support during their time incarcerated, individuals are more likely to die within the first month they are released, to struggle with routines they need to maintain housing, and increase the risk of recidivism. By prioritizing healthcare for incarcerated individuals and allocating the necessary funding to address current concerns and facilitate reintegration, we ultimately make our entire community safer. Providing proper healthcare to incarcerated individuals should be our paramount concern. And as elected officials, you have the power and responsibility to ensure that adequate staffing is a priority. I urge you to view this topic as a public safety and well-being of our community. As a doctor, we take an oath to care about our patients, and as medical professionals, we care deeply about public safety and well-being. Let's start building a better future together for ourselves and our children. Do you have any questions?
There is one question, Senator Anwar, you're asking a question. We're not usually doing questions during public hearing. What's going on?
Thank you, Madam Chair. I just thank you so much, Dr. Bates. Dr. Bates, should the salaries that we should propose be higher because of the difficulty with the recruitment? Thank you, Madam Chair.
I believe so, especially with the increase in price of rents and the likelihood that our staff will be serving mandatory overtime. So, for example, none of the nurses I work with ever leave on time. They're scheduled from 4 a.m. to about 11 a.m. and they're always there until 3 or 4 o'clock, just finishing seeing all the new intakes. And that's not the people who are mandated to stay 16, 20 hours in order to make sure that the facility continues to receive medical care. And that also doesn't include the number of correctional officers who also end up having to stay overtime. This prevents them from being able to see or take care of their children, prevents them from taking their children out from school. And it really kind of adds a bit of like, am I going to be at work today for 8 hours, or am I going to be at work today until tomorrow? And in order to recruit staffing willing to take those risks, we have to have a competitive salary in those settings.
Thank you. Thank you, Madam Chair.
Thank you. Have you, are you a unionized doctor in the Department of Corrections, ma'am?
I believe so, yes.
Yep. So I think the salary recommendations would come through the collective bargaining environment. Thank you, though. Appreciate it. Any other comments or questions? Up next, we're going back to Mark Donald, number 8.
Good afternoon, Madam Chair. Thank you for coming back to me. It's been a long day of travel to the West Coast, and as you can imagine, getting out of JFK this morning was a challenge. But my name's Mark Donald. I'm the Executive Director of RIASAP in Bridgeport, and today I'm going to talk a little bit about our mediation program. The good thing about our mediation program is both an investment from the state level, results in keeping kids out of the court system or going deeper into the court system, but it also reduces the burden on the court system in general. What takes our mediation program 1 to 2 mediators would take 6 to 7 personnel at the court system. But not only does it make fiscal sense, over 90% of our mediation cases that go to mediation are successful 4 to 6 months later as we do the follow-up. Another advantage of mediation that we do incorporates victim voice as much as possible to try and get them at the table. And sometimes that includes restitution. So using this restorative model, we're able to utilize the mediation process to bring young people to the table, to allow them to take responsibility, and most important, repair the harm that they may have caused in the first place. I've also submitted testimony, which gets into the weeds a little bit more, but I think it's important to know that this program exists. There's a demand for it, certainly outside of the 5 courts we're in. We're currently in Torrington, Stamford, Norwalk, and Bridgeport. And other jurisdictions have reached out to us, but for want of funding, we're not able to provide the service. So with that in mind, look forward to any further conversations, especially after you read the testimony.
Thank you very much, and have safe travels out on the West Coast. I hope it's not snowy out there.
Thank you. 60 degrees and sunny.
We're all jealous. Up next is Shonda Brooks. Shonda?
Good evening. Thank you for allowing me to testify today. I apologize in advance. This is my first time doing this formally with a panel, but I'm going to speak on behalf of correction officers here in Department of Corrections. I took this job years ago. Now I've been in 9 years ago, due to the benefits and the great pay. Over the years, things have changed. Our hourly rate doesn't coincide with the raise in cost of living. So with that being said, we are asking and hoping that you will think about increasing our wages to match other states that are around us. Forgive me, I don't have the numbers exactly, but New York, Massachusetts, and Rhode Island have increased their wages for their corrections officers due to the unsafe practices that we have to deal with, the massive number amounts of assaults that we're going through right now, inmate on inmate and inmate on staff, due to the increased out of cell time. So we're working a dangerous job, and our pay does not even match up to what we're doing. We are struggling right now because of the increase in cost of living. And so that's something that would help us out if, also make the job appetizing to other people. Now when I came in, we had like 9,000 people that applied. Now it's hard to get people to apply because the job is not what it used to be. It's changed over the years, and it's very unsafe for us inside the buildings. We're forced to work overtime. Well, we're mandated to work overtime, long hours, missing family events, birthdays, holidays. Just basically our family lives are struggling with this and being affected. So what we're saying is we actually also need more staff, not to take away from our overtime, because we can't survive without our overtime. The only reason why we can't survive is because our base pay is just very low. We could start off with 26,000. I mean, 2,600 every 2 weeks, but we're only bringing home like 1,800. That's not enough to live on. So we need more staff actually to help out, because it's affecting our health. A lot of us are stressed out. We're sick. We're getting sick because we're stressed out, because we're overworked. We do need more posts filled. We don't need to take away from what we have for overtime, but we do need more staff to help out in the facility to make it safe. And with that being said, I know there's a lot of stuff I'm not touching on, but there's other people hopefully that are going to do that. But I'm just asking that you think about increasing our wages to match the cost of living so that we're able to survive, and also adding more posts in the facility to help us deal with the inmate on inmate assaults and inmate on staff assaults. And I thank you in advance for allowing me to testify.
Thank you, Shonda. Shonda, just so you know, in the budget, the governor does increase the number of staffing for correctional officers. That's in the budget. And also, we don't have the authority to raise salaries for unionized workforces. There's an agreement between the parties. The administration handles negotiations with union contracts. So I strongly suggest that you run for union office and talk to them about the wages. That's where that would be addressed. But we are adding, depending on what happens through the budget process, the governor has asked to add more staff in of correctional officers to deal with the assault issue. Thank you very much, Shonda.
All right, thank you.
Up next is Jamie Bell. Jamie Bell, the floor is yours.
Ms. Bell, if I may interrupt, Madam Chair, we have a housekeeping issue. We have a phone number. So I'm going to allow that person to speak. Area code 203-507-8108. Please identify yourself for us. We can't let you in. Can't let you speak unless you identify yourself for us.
Hello?
Yes, can you please identify yourself for us?
Yes, ma'am. My name is Juan Carlos Oreña. I work for the Department of Correction.
Hold on 1 minute.
He's number 7 on the.
Yep, got him. Number 7. So we'll Madam Chair will come around to you soon, sir.
Okay, no problem, ma'am. Thank you.
Thank you. All right,
Jamie,
thank you, Madam Chair.
Jamie, the floor is yours. You're muted, Jamie.
All right, sorry about that. I just switched over to my phone because my camera wasn't working in my computer. Good afternoon, Madam Chairs, and members of the Appropriations Committee. I'm Jamie Bell, the Executive Director of Greater Hartford Legal Aid, which is the legal aid program serving the Greater Hartford area. providing legal representation to injured people with legal problems having to do with their basic human needs for shelter, against violence, benefits, and basic subsistence. Our clients are very, very low income. We strongly support the governor's proposed $2 million funding to continue the eviction right to counsel program through fiscal year 2025. Eviction is a complex legal proceedings, fast-moving, with lots of terms that lay people can understand: summons and complaint, notice to quit, stay of execution. I'm a lawyer 40 years plus and would be challenged to enter into a legal proceeding with complex terms without expert assistance by my side. The GHLA is the Greater Hartford partner in the statewide eviction right to counsel program that's been in effect for about 2 years. Lawyers enable tenants to prevent their defenses. So they can stay in their homes if necessary, get uninhabitable conditions fixed, and gain enough time to leave if that's going to be the result. Our clients are, in addition to having low incomes, they tend to be victims of violence. They're usually people with disabilities, mental health or physical health, and always subject to trauma. The program began in 2022, and since then, across the state, we've prevented evictions or disruptive displacements for over 3,500 individuals and families. They tend to be people of color, certainly victims of violence, and as I said, people with disabilities or poor health. I put a couple of client stories in my testimony, and I won't talk about any of them here, only to note that they're very typical. It's not unusual for clients to have defenses and be unable to understand the legal process or even the language that it's written in. Housing, as you know, is the foundation of stable lives and communities. Not having housing makes it difficult for people to work, for children to go to school, for people to be healthy and to be productive members of society. And stable housing promotes all of those essential human needs. On behalf of the tens of thousands of vulnerable low-income people who need lawyers and able to maintain their stable housing, we urge you to support the governor's $2 million appropriation in his current budget. Thank you.
Thank you very much. Comments or questions? Seeing none. You're all set, ma'am. Juan, Urena, the floor is yours. Juan? Ron, Urena? We now have Amy interpreting for us. Amy, we're gonna keep you very busy. Juan, Urena, are you there? He was just there. Let me know if he comes back in, please. Up next is Allison Ware. Allison?
Good afternoon, Senator Austin, Representative Walker, Senator Berthel, Representative Nuncio, and members of the Appropriations Committee. My name is Allison Weir. I'm the Executive Director of the Connecticut Veterans Legal Center. I urge you to provide the funding for the Right to Counsel program as proposed in Governor Lamont's budget. I'm not going to echo everything that Jamie just said about the importance of the Right to Counsel program, except to point out that Connecticut Veterans Legal Center provides free legal representation to low-income veterans facing eviction anywhere in Connecticut. Thanks to the program, we've been able to add 3 attorneys to our civil legal unit to address evictions, and we represent 150 veteran households in eviction cases each year. I can't overstate how important it is to provide veterans every opportunity for a stable home. Losing a home can be a traumatic experience. For veterans recovering from PTSD, as are many of our clients, the loss of their home can be catastrophic. In some cases, preserving houses can literally save lives. Recently, a client wrote to CVLC to thank for their eviction defense. I want to quote, "We were a bit shell-shocked after the whole ordeal. Fortunately, we have each other. I often wonder about those that do not have close friends or relatives to lean on during such a process. You guys really made it happen. I don't know where we would have ended up without your help. CVLC provides right to counsel eviction representation across the entire state for veterans facing eviction. Thus, our attorneys often meet with veterans in the far corners of the state. The funding provided thus far has allowed us to increase our staff and expand our reach. Additionally, the right to counsel representation opens the door for CVLC to help veterans receive additional legal services, especially those not currently connected with the VA. For those facing evictions, there are often many other legal issues. For example, CVLC attorneys in our veterans and military unit have helped right to counsel clients apply for service-connected disabilities, which can provide a steady stream of income that helps increase their housing stability. The right to counsel program has been a game changer for CVLC's ability to provide legal services to veterans of Connecticut. Please continue this program by including the funding in this budget year. Thank you for your attention.
Thank you, Allison. Any comments or questions? Seeing none, you're all set. Juan, I think you're back with us. Juan? I don't see him. Juan?
Yes, ma'am.
Okay, the floor is yours, sir. Please go.
All right, thank you, ma'am. Hello, my name is Juan Carlos Urena. I work for the Department of Correction. I've worked for the department for over 14 years, total of 16 years with the state. The reason for my appearance today at this meeting is because those who work behind the prison walls, such as correction officers, counselors, and all vital personnel who manage the inmate populations, are under attack. We are being attacked from all sides, coming from our own governor, commissioner, state legislators, outside activists, and the inmate population. We are all suffering not just physically, mentally, emotionally, but financially as well. Why is it for years that we have allowed the state to tell us about our pay, pension, and health care, but to only be diminished? At one time, years ago, Connecticut was the envy of surrounding states as having the best pay, pension, health care. Now we are ranked 11th in the country as surrounding states have increased in wages. In the last 4 years, the state has flourished with millions, if not billions of dollars from passing the marijuana bill, online gambling, pandemic federal money, and so forth. But yet our wages have not increased to catch up with the cost of the living and inflation. We are all struggling to make ends meet. Now the department is trying to cut back on our overtime. They are trying to flood facilities with new cadets just to fill in the positions to cut back on the overtime. We are all struggling to make ends meet, including myself. Most staff have to pick up part-time jobs to make up overtime being taken away. We're asking our governor, commissioner, and those that have power to step up and to help those that are in need desperately. The commissioner, governor, and those who have the power to make changes in our wages to increase. We are no longer the middle class, but the working poor. I asked our governor and state representatives to step up and to show state employees that they care for us. And we're asking them to do it now. Please do not wait. Many are suffering at this point in time and are trying to make ends meet to be able to survive. I thank you for this opportunity.
And thank you, Juan. You do know that the legislature doesn't set the salaries or doesn't do the negotiations for salaries. The salaries are negotiated.
No, I understand it, man. But it's just basically hoping that it doesn't fall on deaf ears, and we're asking our representatives to look at the surrounding states that are increasing in their wages, but Connecticut itself has not increased wages in the last 4 or 5 years. I can tell you this, that the household median income for a single person in the state of Connecticut is $83,000. And my top base pay doesn't even match that. Right. I have to do overtime in order for me to reach that point.
Yeah, well, and I worked in the Department of Corrections as a correctional officer and a correctional lieutenant for 21 years and was a union president. And I strongly suggest that you take your concerns to the union, whichever local you belong to, and run for office. We just raised wages for all state employees 2 years ago, and that's a 4-year contract, so it goes up every year. So I really think you need to go there. I'm just giving you a heads up. It sounds to me like you're committed, and we need committed people running for union offices too. So if you wouldn't mind having that conversation with them, that would be helpful, because we don't have the authority to do that. We already did that when we get the contracts, and we approve the contracts, but we don't do the negotiations. So I worked there. I worked in 7 facilities, so I understand what you're talking about. Okay.
Okay, no problem, ma'am.
Thank you very much. Up
Thank you.
next is Ruth Laro, number 21. There you go.
Hi. Good afternoon. My name is Ruth Laro, and I'm a supporter of Connecticut Against Gun Violence, asking you to please keep the $4.9 million in funding for Project Longevity in place for the fiscal year of 2025. Project Longevity is an evidence-based initiative to reduce gun violence in Connecticut's urban areas, including Hartford, Bridgeport, and New Haven. Law enforcement, social services, and members of the community engage with violent groups and offer assistance such as employment, education, housing, and mental health services if they agree to transition out of their gang lifestyle. These individuals are made aware that if they are under increased law enforcement and scrutiny, and further violence will be responded to with certain consequences. These types of projects have been successful for decades in reducing group-related homicides by as much as 40 to 60%. According to the website everytownresearch.org, it is estimated that gun violence in Connecticut costs taxpayers about $60 million, or about $743 per resident per year. That means that every taxpayer in this virtual room is paying $743 in taxes every year due to the effects of gun violence in Connecticut. By investing $4.9 million in programs such as Project Longevity, we can lower our $60 million yearly bill, as well as prevent needless violent and gun-related deaths. Therefore, it is imperative for both a public safety as well as an economic standpoint to keep community violence intervention funding for Project Longevity in the budget. As a Connecticut resident, I am proud to live in one of the top states in the country when it comes to gun safety legislation. I'd like to thank Governor Lamont and all the legislators who voted to pass the historic gun safety bill last session, which added funding for these meaningful programs that will keep us safer in our communities. Thank you.
Thank you, Ruth. Appreciate it. Any comments or questions? Seeing none. You're all set. We don't have 22 or 23 here. Up next is John Anier. Mr. Anier.
Madam Chair?
Yes.
If you would please, we have been attempting to promote number 23, Stephen Shortman, and he has declined the promotion. So, Mr. Shortman, if you would like to speak, you've got to accept the promotion.
Thank you, Madam Administrator. There he is.
There he
is. Stephen Shortman.
Good evening. Yes, good evening, everyone. Thank you for allowing me to speak. My name is Steve Shortman. I'm correctional officer at McDougal-Walker CI. I've been in the department for 10 years, here to speak on behalf of correctional staff inside the walls and also the offenders and to the state of Connecticut. I'm here to speak about how the job scope has changed inside the walls due to the out of cell time, the changes in our directives 9.5, 6.5, which is use of force, and the penal code of discipline on how we actually manage the inmate population has all changed in recent years. We're looking for the state to help out and compensating us for these changes. Mostly, new equipment. Most here at McDougal-Walker, it took about 6 months for us to finally get the post, but we weren't able to get the whole amount due to the fact we have zero equipment to, radios in generalization, radios to fill those posts. It would be nice if the state of Connecticut think about upgrading the equipment, such as radios and body scanners. Also, the need for new posts. Like I said before, I was directly involved in trying to get more posts here at McDougal-Walker CI to minimize the amount of assaults on staff. Due to the fact it took so long for these posts to actually get on board, there's been at least 4 assaults at this building recently in the last 2 weeks. Thank God, last week they finally got the posts on board, and it seems like it is helping. But I hope the state of Connecticut isn't stopping there and is willing to increase posts here at this building and the rest. Also training. I hope that the department, instead of just in-service training here at the department, I hope we get some outside source training, something more to help adjust to the changes in 9.5 and 6.5. If you would like us to use force in a different way, then please show us that appropriate way, not just speak about it. The need for more pay, I know that you spoke earlier that would be something we'd go through the union. It's just important to speak out on behalf of staff that, our pay is time in the era that we're in, the cost of living here in Connecticut. Our pay looks like it might be a considerable amount, but in reality, what we take home is really not. I've been in the department for 10 years. Due to the 4 zeros that we've had to take in the past, my pay has not gone up very much in my tenure here. State of Connecticut and this panel listens to what I'm saying and appropriates some more money for us next year in the budget. Thank you.
Thank you, Stephen. I encourage you to go to the union to talk about some of the issues, and you would be happy to hear that the governor put some money in for additional correctional staff on the custody side of things. We'll wait to see how we make it through the budget, but appreciate your comments. Up next is John Anir. Mr. Anir? John Anir?
Yep, I'm in here.
Okay, floor is yours.
Thank you. If I start to speak too fast for the translator, please let me know. My name is John Anir, and I've been a correctional officer in Connecticut for almost 13 years, and over 11 of them have been at McDougall Walker. Throughout my career, I've seen a number of what I'd call careless policies pushed down from the top, whether it's coming from the Capitol, the Commissioner's office, or the warden. The newest policies over the last handful of years from the Capitol and Commissioner are not only idiotic, but extremely dangerous and irresponsible. It was your decisions to close Northern CI, which resulted in a spreading of those inmates mostly between 3 facilities. At the same time, the push started on creating policies that did not allow us to hold inmates accountable for their bad, unlawful, and violent actions inside the prisons. Inmates know this and are now able to manipulate the system. Inmates now get caught with homemade weapons, drugs, and alcohol, and get escorted to restrictive housing only to brag on camera that they can only serve X amount of days more in RHU because of how many days they've already been in RHU that month. At McDougall Walker alone, we've had 2 instances where an inmate brandished a shank. Both times, luckily enough, nobody was seriously hurt, even with one almost being a hostage situation. Angel Kuros and Ronald Cotta, with retaliatory actions, have now single-handedly dismantled SOG, which is the Special Operations Group for DOC, and the highest level of tactical support for the department when needed. The department the last few months has been lucky that multiple instances didn't take a turn for the worst when we would have needed SOG, but no longer been able to call on them because they got defunded and dismantled. Yes, our job falls under hazardous duty, but it should be also the state's responsibility to have safety measures in place, and there is none. There are more weapons, drugs, and acts of violence in the prisons now than any other time in my career. If laws and policies are not pulled back, everything will spiral even more out of control, and eventually the worst of the worst will happen. And when it does, you now can't say you weren't warned. Officers, their families, and friends are asking for accountability, not only from the Department of Correction leadership, but from the committee members to ensure the impository of informed, transparent, and common sense safety protocols that will ensure the well-being of everyone inside the walls. With all that being said, our past contract offers have been a complete insult. CPI numbers came out today and were once again higher. At today's CPI numbers, our GWI is now 15.5% behind the CPI numbers since 2016. The correctional officer starting pay in Connecticut is roughly $52,000, And in Rhode Island, they start at roughly $62,000 and $64,000 in Mass. Our top pay is $69,000 and is $20,000 to $25,000 underneath Massachusetts and Rhode Island, which are our two closest neighbors. Everyone has a different monetary amount of money that they want in a raise. I'm simply going to ask you for what you already handed out that you thought was fair to one of the few other hazardous duty jobs in the state. I think we all deserve the same type of respect and contract that was given to the state police, bringing us to an 8-step tier system with a raise at the bottom, which will help bring in qualified candidates, and raising the top pay by double digits to help with how far behind we are with inflationary living costs. Bringing all those at the current top step to the new top step will be one way to catch up with the rising cost of living in this state and help attract more qualified candidates, as our application numbers have been at a record low. Thank you.
Well, thank you, Mr. Anier. And again, I strongly encourage you to bring your wage concerns to the union, because that's where it has to start.
I understand that.
Thank you. Appreciate it. Madam Administrator, you said you have a phone number?
Well, we did, Madam Chair, but the phone number's dropped off, so I'll keep you posted if they come back on.
Okay, thank you. Number 25 is not here. Up next is Danielle Cantor. Danielle?
Hi, Senator Ostin, Representative Walker, and distinguished members of the Appropriations Committee. My name's Danielle Cantor, and I'm from Fairfield. I'm also a senior in high school and part of Connecticut Against Gun Violence's Youth Council. Currently, guns are the leading cause of death for children.
Thank you. Go ahead, Danielle.
Project Longevity has been proven to save lives, including lives of children living in the most vulnerable situations. Similar programs across the country have shown similar results, reducing shootings and deaths in our cities. I understand that we are at a fiscal cliff and there's pressure to cut funding, but I urge you to maintain the $4.9 million in the governor's budget for fiscal year 25 for Project Longevity to continue to save lives. Thank you.
Thank you. Comments or questions? Being none, you are all set. We don't have number 27. Up next is Angela. And Angela, I'm not saying your last name.
That's okay. Thank you. It's Angela Schlingheide. Good afternoon, Senator Austin, Representative Walker, Senator Berthel, and Representative Nuccio, and members of the Appropriations Committee. My name is, again, Angela Schlingheide. I am the Executive Director at the Connecticut Bar Foundation. Connecticut Bar Foundation is the primary funder of civil legal aid in Connecticut, and our mission is to facilitate systemic change that advances civil justice for all. Specifically, CBF administers several grant programs that fund the delivery of legal services for Connecticut residents who cannot afford an attorney, one of those programs being the state's Right to Counsel program. CBF thanks Governor Lamont for his proposal to allocate $2 million to provide additional funding for the Right to Counsel program and submit this testimony in support of his proposal. The program provides no-cost legal representation to income-eligible tenants and occupants at risk of eviction or subsidy termination, and the allocated funds will ensure that services continue to be provided to our most vulnerable residents who are at risk of losing their homes and often at risk of becoming homeless. Since inception, the providers have prevented evictions or disrupted displacements for 4,372 clients. Clients include victims of domestic violence, people with poor health or disabilities, and people struggling with low incomes who are disproportionately more likely to face eviction. Stabilizing these vulnerable tenants prevents unnecessary hardship and saves the state money. In fact, it has been reported through independent evaluation that Connecticut realized economic benefits of at least $17.6 million to $21.4 million because of the Right to Counsel program. The cost savings are attributable to savings in areas such as emergency shelter services, child welfare, increased employment and income stability, healthcare, and education. In the first 10 months of this program alone, the number of tenants represented in evictions across the state increased more than 60% from pre-pandemic 3-year average, and that number has only increased in year 2 of the program. The lawyers are assisting in cases that have substantive and often complex legal issues that unrepresented litigants would not be able to navigate alone, as well as addressing prior gaps in access to legal representation. Access to counsel during this process helps prevent disruptive moves, helps people gain more time when they can't avoid a disruptive move. But even more importantly, it provides tactical parity for the tenants and the landlords in this litigation experience. Because if you're facing an eviction and you don't have access to an attorney, that is not equitable justice. And people's access to justice should not be determined by where they are in the economic status. Housing is the foundation of successful lives and stable communities. Eviction makes it difficult for people to work, for children to go to school, and for everyone to be healthy. CBF urges the committee to support Governor Lamont's proposal to allocate $2 million to the Right to Counsel program in order to ensure that this program can continue to provide these critical services to the low-income residents of Connecticut. We thank you for your continued leadership in regards to this program. And if you have any questions, I'm happy to answer them.
Well, thank you very much, Angela. Appreciate your comments. Any comments or questions? Seeing none, you are all set.
Thank you very much.
Number 27 and number 30, you need to accept promotions for you to be able to speak. I see number 27 is there. Number 27, Nicholas Buckland, the floor is yours. Nicholas Buckland.
Hi, can you hear me?
Yes. The
All
floor is
right,
yours.
thank you. Good afternoon, everybody. My name is Nicholas Buckland, as you just stated. I have over 10 years experience with the department, and I'm urging the state legislators to not cut any positions in the new DOC budget. Our facility needs these posts for many reasons. For starters, the inmate-on-inmate assaults are at an alarming rate. In the year 2023, we had over 200 staff assaults, but let's keep in mind that our population of convicted felons are lower than they have been in many years. The new laws, consisting of 5 hours of out-of-cell time, has caused the increase of inmate-on-inmate assaults. With the new positions, it would help keep the population safe. We'd have less staff on workers' comp. We'd have less lockdowns, and we all know why we have lockdowns, because of inmate-on-inmate assaults and code oranges. We'd also have less lawsuits. We'd also have an increase of staff safety. Staff has done their duty through the COVID crisis. Staff does their duty in keeping the public, inmates, and staff safe every day. Now we need legislation to do its duty and provide us with more posts, more staff, fair pay, and retirement. That is all.
Thank you.
Thank you.
Up next is Christopher Prue. Christopher?
Hello, everybody. Good afternoon, almost evening. Good evening to senators, representatives, and all members of the Appropriation Committee. My name is Chris Pruss. I am the Director of Residential Treatment Programs. I work for an agency called Connecticut Renaissance. We operate several halfway houses with DOC contracts. We also have numerous CSSD contracts spanning throughout a bunch of different programs between outpatient. Most importantly is one that I oversee, a residential treatment program that works with clients who are currently on probation or clients who are currently on bail. These clients are typically struggling in the community. They're the ones on bail have been recently arrested due to some type of issue with substance use. This program serves over 500 adult males each and every year that all have substance use and mental health disorders. Without this program like it, this burden is put back on an already overwhelmed system of hospitals and outpatient providers. And this kind of keeps that rotating door of clients in and out of treatment really with no stability. So our residential level of care really helps stabilize clients further. Many of these clients come to our program with no former stability and really a grim outlook on their prognosis. Many of the clients we serve are at a much higher risk of life-threatening outcomes such as overdose, death, violence, homelessness, and untreated medical issues. However, over time with our programs and others like it with our clinical and medical staff are really able to change this prognosis and greatly improve their chances of being stable and being a productive member of society. So we can see how these programs are very important to the overall community and to the clients that we serve. Greatly appreciate the increase last year, which was a 2.5% increase on our state contracts. But unfortunately, with ever increasing inflation, the last month the minimum wage just went up by 4.6%. So we're already behind the 8 ball again, and we seem to be facing this each and every year. So we've lost ground, continually running at risk of running over an already tight budget to ever increasing costs and inflation. So really, further increases are definitely needed to keep our programs going. Thank you for the opportunity to testify on House Bill 5048 and the governor's budget. I'm here to request increased funding for community nonprofits by 5%. And that is all. Thank you.
Thank you very much, Christopher. Appreciate it. No comments or questions. So number 30, you have not accepted the promotion. You can't speak unless you accept the promotion to speak. So keep that in mind. So we're going to go right on to number 31. Jonathan Perlow. Jonathan, the floor is yours.
Thank you. Hello, Madam Chair and distinguished members of the Appropriations Committee. Thank you for this opportunity. My name is Jonathan Perlow. I'm Director of Communications for Connecticut Against Gun Violence. I'm testifying in support of the $4.9 million in the Judicial Department Fiscal 25 budget to fund Project Longevity. I know there are significant budget pressures, but I urge you to protect the entire appropriation. During the 10 years I've been affiliated with CAGV, it's become apparent that in addition to the strong regulation of firearms that helps give Connecticut one of the lowest gun death rates in the nation, we must invest in anti-violence programs. Project Longevity, built on the proven focused deterrence model, is one such program. Although gun murders are down from their pandemic peak, Connecticut's larger cities are still dangerous, accounting for the majority of interpersonal street-level gun violence. In the face of this public health crisis, it's important that Project Longevity and similar violence reduction programs funded out of the Department of Public Health be fully funded as the governor has proposed in his budget. Although the legislature has a proud history of passing effective laws that make it difficult for guns to fall in the wrong hands, because of weak federal gun laws, it remains far too easy for individuals to buy illegal guns. That's why it's so important to invest in public safety programs like Project Longevity that provide means and incentives to avoid interpersonal violence, especially with guns. These programs work. Recent research out of the University of Pennsylvania found that a program similar to Project Longevity reduced shootings in a high-crime Baltimore neighborhood by 25% over just 18 months. I first testified before this committee in support of Project Longevity in 2017, when the program was facing steep cuts in the face of a dire budget situation. To its credit, the committee restored some of the funding and has since increased funding to enable the program to expand to other cities. We commend this committee and the Connecticut General Assembly for steadily increasing funding to evidence-based programs that de-escalate conflict and break cycles of violence. Project Longevity not only saves lives, it changes them by giving participants ways out of behavior that too frequently ends up with them being victims or perpetrators of gun violence. Last year, one participant talked about the training program he took to learn a trade and have access to a well-paying career. He said, "It's definitely kept me on track and focused on building a future for myself. Everything that they offer is really worth it, and I feel like this is something a lot of other people should do." The increased funding proposed by Governor Lamont will help Project Longevity reach more at-risk individuals. Please continue Connecticut's proactive stance in addressing the crisis of gun violence by fully funding Project Longevity as called for in the governor's budget adjustments bill. Thank you so much for your consideration today.
Thank you very much, Jonathan. Seeing no questions or comments, up next is Alexis Smith. Alexis?
Thank you very much for your time. Good afternoon, Senator Austin, Representative Walker, and all the members of this esteemed committee. My name is Alexis Smith, and I'm the Executive Director at New Haven Legal Assistance in New Haven, Connecticut. Our mission is to provide high-quality legal services to New Haven area residents who cannot obtain a lawyer because of age, disability, age discrimination, or other barriers. I am respectfully requesting the Appropriations Committee support funding for the Right to Counsel program, where Governor Lamont has indicated a $2 million amount to be requested. Let me begin by extending my gratitude to members of the Connecticut Legislature for the passage of Connecticut's Right to Counsel program, which began in 2022. Connecticut is now part of 22 jurisdictions, including 17 cities and 4 states nationally with the Right to Counsel program for tenants. This is a growing movement, and we should be incredibly proud to be part of it. Right to Counsel captures decades of work by many legal services attorneys, community organizers, social service providers, among others, to ensure people in need of civil legal assistance can obtain it. As you heard earlier from Angela Schlingheide, there are many numbers behind the program that we've been implementing for the past 2 years. Nearly 4,000 individuals and families have been served, the cost savings to the state of Connecticut. What I want to tell you is some of the stories behind the numbers, that there are real individuals and families behind those numbers. So at New Haven Legal Assistance, we have been able to add an additional 8 new housing attorneys in the last 2 years to our team. And that's allowed us to handle double and sometimes triple the number of monthly housing eviction cases compared to prior years. I also want to tell you who is being evicted in our state. So nearly 69% of the clients that we represent identify as women of color, many of whom are mothers. So the individuals being evicted in Connecticut are women and children. And nearly 11% of our clients identify as having Spanish as their primary language. So sustaining this program with permanent funding is a matter of racial justice. We also see many individuals who have disabilities who are being evicted and many individuals who are victims of violence. So having a lawyer in eviction proceedings really matters. Eviction cases are complex, they move really quickly, they focus on possession of property rather than preservation of the basic human need for shelter. Our lawyers at New Haven Legal Assistance and throughout our Connecticut Legal Aid Network are able to prevent individuals and families from being wrongfully evicted, or help negotiate fair and reasonable settlements, or work with clients living in substandard housing conditions, or assist clients in need of securing new housing. Lawyers representing tenants balances the power dynamic that exists in housing court. Historically, over 80% of landlords are represented by attorneys, while less than 10% of tenants have been represented. And so we are trying to shift that power imbalance and have been able to do so over the last 2 years. The last thing that I want to say to you is while Right to Counsel has dramatically allowed us to increase the number of clients that we represent in a given year, it should not be lost on us that we continue to face a housing crisis in our state. Eviction numbers and homelessness levels are really high right now. So it is urgent to continue the Right to Counsel program to ensure Connecticut residents have the ability to fairly and adequately access the justice system. Thank you again for your time, and I again request you to support the governor's $2 million proposal to continue the Eviction Right to Counsel program. Thank you.
Thank you, Alexis. Seeing no comments or questions, and not having number 33 or number 34 here, we're going next to number 35, Marcus Blackwell.
Good afternoon, Senator Olson, Representative Walker, Senator Winfield, Representative Candelara, and members of the committee. My name is Marcus Blackwell, and I'm a chaplain with the Department of Corrections. I'm here today to testify that the increased funding to hire more chaplains within the Department of Corrections in the governor's budget is important, but it needs to be increased for many reasons I will speak about today. First, because of short staffing, chaplains are stretched with covering multiple facilities. Requiring chaplains to cover multiple facilities has been an ongoing practice for years, mostly due to chronic short staffing. I have personally covered up to 3 facilities as far as Newtown and as north as Garner and as north as Medulla, Walker, and Suffield since starting DLC some 9 years ago. It has been an ongoing problem which results in untreated stress, fatigue, burnout, unnecessary wear and tear on our vehicles, and direct illness that results in work-related injuries and trauma. This problem has been exacerbated by the multiple retirements and acute attrition of DOC staff. Funding for additional staff would allow more chaplains to remain dedicated to their base facility and effectively meet the needs of staff and inmates. This shortage of available chaplains has also led to many missed and canceled religious services programs on behalf of the inmate population. And at this point, this problem has now garnered the scrutiny from the Department of Justice, which may require government oversight for the next 3 years as we seek to rectify this situation. Secondly, the work of chaplains is critical to the successful reentry of incarcerated individuals. The reduction in recidivism improves when we do our job right with programs, services, and counseling. We impart and implore best practices in spiritual development and moral compassing, which helps people make the right choices in their respective families, vocations, and overall community involvement. Chaplains give inmates hope, purpose, and direction, while also helping them to understand how to be accountable for their actions. Religious services personnel also provide mentorship through related programs such as financial literacy or stewardship classes, fatherhood classes, and of course, the debate team, just to name a few. Thirdly, chaplains counsel both inmates and staff related to trauma and well-being. Though the mortality rate among correctional staff nationally is still way too high. Chaplains are first and second responders to staff members when they are assaulted or traumatized at work and beyond. We are invaluable to our correctional brothers and sisters, as many of them, due to their schedules and mandatory overtime needs, miss their own religious services and spiritual maintenance. And quite often we serve as the only religious figure they may encounter during the week. Finally, DLC chaplains are required to walk on water while also parting the Red Sea with few, if any, accolades and resources besides help from God and unwavering faith in our divine calling. However, more money for staffing, programs, and travel will make these miracles more within reach for these dedicated men and women. And believe me, it's a miracle in and of itself that we still do so much day in and day out within a volatile environment that isn't properly funded. So thank you very much for your time. I'll be happy to answer any questions if you have any.
Thank you very much, Marcus. Appreciate your comments.
Thank you.
Up next is Colin Provost, number 30. Colin, there you
Hello.
go.
Sorry, I guess something glitched because my screen kept on spinning, so I just zoomed it out and logged back in. I apologize. I have a bit of a frog in my throat. Been dealing with this for a couple of days now. But good evening, Chair Walker, Chair Austin, members of the Appropriations Committee. I'm the president of Connecticut State Prison Employees Union, AFSCME Local 391, a member of Council 4. And I'm speaking on behalf of all of our locals and our members, which represents about 4,000 plus correctional employees in the state. This budget adds 312 new posts in correctional facilities. We believe that at least 112 of these are for corrections posts and their officers. I know that we will get more information as the budget process unfolds. We are dangerously undermanned right now. We appreciate that Lamont administration told us last week that the new posts will be implemented now in order to cut down on assaults. There has been an increase on inmate on staff assaults. We appreciate the governor's budget narrative acknowledges this. The way to stop assaults is by increasing correctional employees manning, and to do so now. It's incredible that some advocates have expressed opposition to this increase in posts. Everyone should support increase in posts. This increase out of cell time has been pushed upon us very fast into being and not having a lot of adequate preparation. This has led to disruption in correctional facilities and an increase in assaults. Facilities were not designed to accommodate this many inmates, all being out of their cells at once. This means that we have to provide recreation for groups of inmates who are supposed to be kept away from each other in the same hallway at the same time. This all requires more staff. In short, more posts means more staff on duty. This means fewer assaults. Fewer assaults means fewer lockdowns. What is the downside? The cost of posts will probably be offset by fewer lawsuits against the state by inmates who have been injured in fights. It'll also reduce the amount of workers' comp that is being put through by all of the incidents that are happening. We also want to give you a heads up that the wage reopener will be coming in this session or the next, depending on negotiations or arbitration. Correction employees' pay must be increased and pension must be improved in order to retain and recruit new staff. It was unfortunate that so many state legislators voted against our pay increase last time. Our members did their duty through COVID crisis. Our members do their duty of keeping the public, inmates, and staff safe every day. We need the legislators to do their duty and provide us with more posts, staff, and fair pay and benefits. Thank you for your consideration. We are happy to answer any questions.
Well, thank you, Colin. Appreciate that. You have a nice night. Get better.
Thank you.
Up next is Fernando Munez.
Thank you, Senator. Good evening, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Fernando Muñiz, and I'm the CEO of Community Solutions. We're a nonprofit organization with a long history of providing services to Connecticut's neediest residents. In the criminal justice field, we operate 6 halfway houses for the Department of Correction in Hartford and Waterbury, and 5 alternative in the community programs for CSSD in Bridgeport, Danbury, Torrington, Norwich, and New London. On any given day, hundreds of people in our state benefit from the work our staff are doing in these programs. Thank you so much for the opportunity to testify on the governor's budget. I'm here to request that you increase funding for the community nonprofits by 5% this year. This equals roughly $186 million. My staff and I are deeply appreciative of the increases the legislature has been able to provide over the last few years, but they have not been enough to meet the needs of the people we serve. We continue to be hit by a crippling increases in our costs that far outpace the rate of increases the legislature has provided. For example, last year we received a 2.5% increase on our state contracts, but last month the minimum wage rose by 4.6%. Even with the recent increases, we lost ground as an organization. Filling positions at our programs continues to be a significant challenge, as the wages we are able to offer through our contracts with the state are not really competitive in today's job market. We're filling many of our shifts through overtime, which causes significant burnout for our staff. And inflation is impacting our programs in many other ways. Like state government itself, for us, the cost of materials, food, insurance, maintenance for our buildings continue to rise on an annual basis. It's simply not reasonable for state government to expect the same level of service year after year with flat funding or increases that do not keep up with inflation. Last year's budget closed Willard Correctional Facility, resulting in $6.5 million in annual savings to the state. But none of those savings were reinvested into the community programs like ours that keep people out of prison or significantly reduce their recidivism rates. In fact, none of the savings from the prison closures over the last decade, now a combined $26 million annually, have been reinvested in community programs. I'm here to say that demand for our services have never been higher. Without realistic cost of living adjustments, the capacity of these programs to help Connecticut citizens will be greatly diminished, and I fear that some of those programs will actually need to close in the coming years. I want to close by saying I'm kind of glad that we're doing this hearing today on Zoom on a snowy day. This morning, state government buildings across the state closed due to inclement weather. But you know who went to work in person this morning? The staff at our halfway houses, and they deserve your support. Please consider supporting an increase for community nonprofits by $186 million in 2025. Thank you for the opportunity to testify.
Thank you very much. Appreciate it. Up next is 37 is not here, so we have 38, Sarah Rodriguez.
Good afternoon, senators, representatives, and members of the committee. My name is Sarah Rodriguez. I've been a certified dental assistant and a part of the dental community for almost 11 years. Only recently have I started working for the Department of Corrections, which has been a dream of mine for many years. I'm honored to work alongside such amazing, competent healthcare professionals. I'm here today to talk about the need for more funding for the Department of Corrections healthcare line. Without more funding, we cannot recruit and retain staff. This transition from the private sector to the state of Connecticut has been very hard for me financially. I took an almost $10,000 pay cut, and the mental stress I've been under is beyond unbearable. The assistance I've had to turn to in order to just barely get by is unfortunate. I'm so underpaid, and I wonder if I'm actually going to be able to pay my bills and take care of my family after I receive my paycheck. Almost every day that passes, I question my job change and try to hold on to the exciting feeling of fulfilling my dream. If my coworkers and I were compensated similarly to the private sector, the difference it would make would be profound. Appropriate compensation would improve services for the incarcerated population tremendously, because we would be able to recruit enough staff to cover the demand for care. It would make such a safer environment because the workload wouldn't be as vast and we would be less stressed. It would vastly improve staff morale as well, both by alleviating our workload and because we wouldn't be under so much unnecessary financial stress, causing short tempers or irritability. We won't be exhausted and run down from working multiple jobs, because a lot of us do, just barely to make ends meet. We have to be awake and alert at all times, but when working multiple jobs, it's hard to have the time to rest outside of work. Staff would be more likely to work with the all hands on deck approach and feel like the compensation is worth the work they're doing. The services that the dental team provide are extremely essential to the population we serve. Some of the population we serve may not have had proper resources to maintain any type of dental care prior to incarceration, so they fully depend on us to provide the care they need. Some of the population we serve will have no other option but to be fully dependent on us for the remainder of their life to provide the dental care they need. Good oral health is vital to remain healthy overall. I want to make a difference and help where I can. Competitive compensation can result in better recruitment of employees and retention of staff. Something has to change. Thank you so much for your time.
Thank you, Sarah. Up next is Lori Williams. Lori?
Good afternoon, Senator Austin, Representative Walker, Senator Winfield, Representative Candelara, and members of the committee. Thank you for giving me this opportunity to speak with you. My name is Lori Williams, and I work as a rehabilitation therapist in the Department of Correction, providing music therapy services to the incarcerated individuals at Manson Youth Institution. I'm here today as a member of District 1199, New England, to advocate for funding to expand the rehabilitation therapy services that are offered in the Department of Correction. Rehab therapy services consist of art therapy, music therapy, and recreation therapy, and are being underutilized within the DOC. Currently, DOC has only 4 rehabilitation therapists, 1 rec therapist at Garner CI, and 2 rec therapists along with myself at Manson Youth Institution. And art therapy is currently not offered. Incarceration is a period of time where freedom is restricted, and as a result, spirits may wane. Rehab therapy services are a vehicle for transformation and provide opportunities to unlock creativity, for self-expression, for personal growth, to promote emotional healing, and build pathways for reintegration into the community. They are safe and non-confrontational, making them highly sought after programs by the incarcerated individuals. They are able to process their own past traumas and their difficulties with substance use and mental illness. Recently, a group of young people at MYI had the opportunity to share original music they created in a performance where members from the MYI and outside communities attended. For the 2 hours that they performed, they were able to be seen for their talents rather than their mistakes. They were seen for their strengths that they have to offer to the community rather than the harm that they have caused the community. They walked away from that performance a little taller that day with their heads held high. They were told how great their performances were, and they were proud of themselves. The lasting effects of that pride and knowing that they have something to offer this world builds motivation to do things differently. I have just one more story I'd like to share with you today, although I could go on for days about the benefits that I see in the music therapy program. I had a young person who asked if he could attend music therapy on a day that was not his scheduled day for group. He said he just needed it that day, and there was a space that was open, so he was able to attend. And he worked that entire session with a peer creating an original song. The next day he spoke with me about that experience. He said that was the first night since he was incarcerated that he went into his cell and did not think about that door closing behind him until 8 the next morning. He was happy and continued to think about the song that he was creating. He experienced mental freedom from confinement that night, and the benefits of that go beyond anything I can ever express in words. Art, music, and recreation therapy are powerful catalysts for transformation and rehabilitation. As we strive for a more compassionate and rehabilitative approach to criminal justice, it is imperative that we recognize and harness the potential that these services have for positive change. By investing in expanding rehabilitation therapy services in the DOC, individuals can be empowered to rewrite their narratives, reclaim their humanity, and build brighter futures beyond the prison walls. Thank you for your time.
Thank you, Laurie. Appreciate that. Up next is Sean Reeves. Mr. Reeves? Sean? There you go.
Good afternoon, Senator Olson, Representative Walker, Senator Winfield, and distinguished members of the Appropriations Committee. My name is Sean Reeves. I'm from New Haven, Connecticut. I'm an employee of Connecticut Against Gun Violence. I'm testifying in support of the $4.9 million in the Judicial Department of Fund Project Longevity as proposed in the governor's budget adjustments for 2025 fiscal year. Project Longevity is an evidence-based group violence intervention program designed to reduce gun violence in Connecticut's urban centers. Decades of research have demonstrated that similar programs around the nation are very effective in reducing shootings and gun fatalities. I also support judicial department funding for other programs aimed at reducing youth violence, including Youth Violence Initiative and Youth Service Prevention. My son, Sean Reeves Jr., was killed in 2011 due to community gun violence. And since then, I've taken a much more active role in helping to end community gun violence in the city of New Haven and around the state. The city of New Haven has embraced the Project Longevity model for more than a decade. I've personally been involved with Project Longevity for more than 5 years, sharing my personal experiences of loss for the loss of my son and the impact that it's had on myself, my family members, friends, and community, as well as offering hope for those that want a better future for themselves. I've utilized my own personal life's experiences to support the fact that they can change, and I, do my best to provide tons of different opportunities and options for these young men and women to really redirect their lives as well. In 2021, the Connecticut General Assembly passed SB 1, which declared racism a public health crisis and established the Commission of Community Gun Violence Intervention and Prevention. The structural racism that drives health disparities is also a root cause of community gun violence. And to achieve racial equity, people must be safe in their communities where they live. Investing in programs like Project Longevity and other community-based programs that have proven track records of reducing gun violence is part of the solution. I strongly urge you guys to continue or to keep this budget as is. If anything, we always need an increase in budgeting. Systemic racism practices have decimated communities of color, such as mine, for longer than I've probably been alive. But over the last 30 years, as a father and a parent, and a strong community member who runs businesses and other nonprofit organizations here, we know that we need all the resources that we can get in order to make this work. It's just a small drop in the bucket. This is not the end all be all, but it is a fresh start to a new beginning, and Project Longevity for the last couple of years has had enough funding to do a lot more than they've done over the last 10 years since I originally joined that program and really started working with them. So the housing supports, all the additional support services that they provide are really making a difference, and we want you to make sure we continue to keep this budget the same. Thank you.
Thank you, Sean. Representative Walker, I've already
Sean.
yelled at Senator Anwar.
Yeah,
So
I just
consider this a yelling at you.
Thanks, Sean. Thank you for coming up and testifying and sharing your story. And it is a good beginning. we just have to keep going in the right direction. And thank you for all the programming that you provide. So good to see you. Thanks.
Thank you. It's good to see you too.
Up next is Richard Boritz.
I have to tell you how moved I am by Sean's testimony. It takes away any impact I think mine will have. It's just so moving. Senator Osteen, Representative Walker, and distinguished members of the Appropriations Committee. My name is Richard Boritz. I live in Southbury, and I'm speaking in support of maintaining the $4.9 million funding for Project Longevity. I first learned of Project Longevity as a volunteer for Connecticut Against Gun Violence. Through them, I had invited Stacy Spell, the New Haven program manager, to speak to residents of Heritage Village in Southbury. He told us about his efforts to reduce violence in that city of New Haven. And some of what he said to us is this. This is a quote. "I'm not looking for a hug-a-thon, but a different way of doing business. The whole initiative is about groups working together, including social services, law enforcement, and faith-based organizations. We have gathered law enforcement groups together in New Haven and surrounding areas so that they can respond to violent crime in real time. Too many young men have taken their last breath on the sidewalks of New Haven. Cooperation is the key. I have lost 2 nephews, and my sister has lost 2 sons." Well, as a resident of Sandy Hook in 2012, when Project Longevity started, I know firsthand the devastating effects gun violence has on victims, their families, and communities. The trauma these experiences produce affect people for years to come. In addition to trauma, though, economic costs of gun violence shows how fiscally sound the state's investment is. One study estimated that law enforcement and healthcare costs for a single homicide are about $500,000, and that each non-fatal shooting costs about $71,000 for the state's citizens. By that estimate, last year's 108 gun homicides alone cost Connecticut taxpayers about $50 million. Since 2012, Project Longevity has directly engaged with violent groups, and this is a quote from their mission statement, to communicate a community message against violence, a law enforcement message about the consequences of continued violence, and an offer to help those who want it. To accomplish this, law enforcement, social service providers, and community members have been brought together to create long-lasting relationships with violent groups and gangs in some of our cities, end quote. For these reasons, I urge you to maintain the funding for this group. Thank you.
Thank you, Mr. Boritz. Up next is Melissa Kane. Melissa?
Hi. Thank you. Good evening, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Melissa Kane. I live in Westport, and I'm the board chair and interim executive director of Connecticut Against Gun Violence. I, too, am testifying in support of the $4.9 million in the Judicial Department to fund Project Longevity, as proposed in the governor's budget adjustments for fiscal year 2025. I am well aware that there are significant pressures on the budget, but I urge you to protect the entire appropriation. I will be brief, as you have heard from so many eloquent constituents as to why this small increase in funding to Project Longevity is essential. What I will say is that the reason you have heard from CAGV and its supporters here today is that we know that programs like Project Longevity are directly related to a decrease in gun violence and to some of its root causes, including cycles of violence, hopelessness, and recidivism. The truth is that strong gun laws, that keep guns out of the hands of dangerous people are crucial, but they are not sufficient for preventing gun violence, especially community-level gun violence that disproportionately plagues Black and Brown communities. As you have heard, and has been backed up by copious research, programs like Project Longevity, especially its remarkable call-in format, are important because they operate to prevent the conflict that leads to the violence, and they offer alternatives to those most at risk of violence. The Youth Violence Initiative and Youth Services Prevention are programs similarly aimed at reducing youth violence. I testify in support of Judicial Department funding of these programs as well. In 2021, the Connecticut General Assembly passed SB 1, which declared racism a public health crisis and established the Commission on Community Gun Violence Intervention and Prevention. Because the structural racism that drives health disparities is also a root cause of community gun violence. If we want to achieve racial justice, people must be safe in the communities where they live. To do this requires continued dedication to funding successful programs like Project Longevity that have proven track records of reducing gun violence. I thank you for taking the time to listen to me and to all of the others speaking today in favor of keeping this appropriation intact.
Thank you, Melissa. Appreciate it. Up next is Matthew Wallace.
Good evening. I would like to thank the co-chairs, Representative Walker and Senator Ostin, as well as the vice chairs and ranking members of the Appropriations Committee for allowing me to testify today. My name is Matthew Wallace. I am the president and CEO of VRSim. We are an East Hartford-based company which designs virtual reality and simulation-based training systems for the skilled trades. These include things like welding, industrial painting, certified nurses, and emergency responders. Connecticut has a well-documented workforce shortage in the skilled trades. The jobs are plentiful. Our juvenile justice career outreach programs can provide a way to address the shortage by providing quality job training for those who are seeking re-entry into the workforce. These are good jobs with companies that need them, and we can train the people to make it better. Our systems, designed and built in Connecticut, support skills training by aiding in the preparation for certification, spot training, and qualification among the skilled trades. Additionally, our experience shows that they are effective tools of recruitment and outreach in helping the individual inmates find the right job for themselves. For 20 years, VRSim has found consistent success in facilitating skill development through blended learning methodologies. Research studies show that replicating traditional kinesthetic learning experiences, such as welding and painting, using virtual reality create a more effective training experience than traditional models. In essence, virtual reality training is the modern apprenticeship. Nowhere is this approach proven more effective than helping those who are re-entering the workforce. Youth in the juvenile justice system face significant hurdles due to a lack of practical job skills, limited educational achievements, and the stigma of their involvement with this system. Many cannot escape the cycle of unemployment, and this increases the likelihood of recidivism. With quality instruction and administrative support, our systems can be utilized to provide an enhanced apprentice-level training experience that will speed re-entry into the workforce. Equipped with job-ready skills, the youth have a smoother pathway to employment and an easier integration back into society. VRSim is seeking $500,000 for a pilot program that will allow us to provide the systems and necessary user training for Connecticut juvenile justice career development programs to invest in practical virtual reality training for the skilled trades. Thank you for listening to my testimony. I'm here to answer any questions you may have.
Thank you, Mr. Wallace. Appreciate it. I don't see any comments or questions. Up next is Jonas Diaz. Mr. Diaz.
How are ya? Is everybody able to hear me?
Yes, we can hear you. The floor is yours.
Hi, how are ya? Thank you, Senator Austin, for your services in the U.S. Army and the DOC, other representatives watching this. I'm here today to ask about the budget increase towards the DOC and dedicated personnel. You have stated that we need to talk about our union representatives, about wages increase, but they tell us to go to you to talk about these items and these specifics while you are telling us to go to them. So we kind of feel on the edge over here in which we do not know who to talk to. So I'm going to talk about something different. Our facilities are getting a little bit outdated, a little bit out of age and time. We need a budget helping us when it comes to equipment, facility HVAC system, and other stuff. Every day we kind of breathe a very toxic air throughout moldy, black mold and other stuff that has been found in these systems. And our equipment are not up to date, which will put us at risk. And not only us, but it actually puts the inmates at risk. If we're not able to communicate with each other properly, it could be, and it could grow into a much larger problem. And that's just on the communication aspect of things. When it comes to the actual facilities falling apart, I have witnessed, and everybody over here has, we have leaks on our roofs sometimes, many times, to be honest with you. These are dangerous things that could actually collapse at any time, any point in time. We also have lack of fundings on many of the machineries, equipment, cooking equipment, for the kitchen, of course, that's what I'm talking about, and funds on counseling and other aspects of things. It is a constant talk and subject talked about and discussed about the staff. So if anything that I would like to say over here is, do not neglect the Department of Corrections staff and its facilities while focusing too much on the inmate rehabilitation aspect of things. It is the responsibility of the Department of Correction to take care of these inmates that the society has awarded to us. And it is the responsibility of our government and our state to support us so we could do the right and proper job taking care of these things. So we are asking the committee. Everyone else has stated really good things. Yes, please do not neglect the Department of Correction and the budget increase that we are demanding, not only on the facilities, but also in our wages to catch up with the times. And that would be it for today. I appreciate you guys listening, and thank you very much.
Thank you. Those are things we can look at. Thank you for that. Appreciate it. So first, I think, Madam Administrator, is there anybody else that we have?
No, ma'am, we have exhausted those folks that came on.
Thank you. So I want to, all of us can give a big wave of hands to our interpreters for doing what they did. We really appreciate that. You're really valuable, and we really like having you here because it opens up our committee to other people, and we often have people that want to listen in that could not understand what we were saying. So thank you, thank you, thank you. Appreciate it, appreciate it, appreciate it.
No problem. Here for all of you.
Thank you. Representative Walker, any final words?
No, just that there was a lot to be heard today, and we've got a lot of conversations that need to be discussed, a lot. So thank you, everybody, and thank you all for being here and staying. Well, it's also because it's light outside, so everybody's still around. But thank you, Appropriations team. It was great to have all you here. Thank you very much.
Senator Purcell? All set?
Sorry, I couldn't find the mute button after all these years. So no, this was very effective. Thank you for keeping it moving. I think we do the best job as a committee with that 3-minute piece and truly trying to limit some of the comments that we know all of us can make and extend these public hearings on for what seemed like days. So thank you for that. It's much appreciated.
Representative Zawistowski.
Thank you, Madam Chair. I want to say thank you to everybody who took the time to testify this evening. There are truly some compelling stories, and we have a lot to think about. Thank you, Madam Chair.
Thank you. Senator Winfield, any comments?
No, good night.
Representative Candelaria.
No comments. Good testimony today. There's a lot of two parts to deal with and think about. So thank you.
Thank you. All right, everybody. Madam Administrator, what do we have next?
On Thursday, Elementary and Secondary Education Day, my friends. And just so y'all know, at the moment, we have 195 registrants.
Oh, God.
For Thursday?
Yes, ma'am.
All right, well.
Wow.
I hope what time do we start?
In the afternoon, 2:30 maybe?
2 p.m.
2 p.m. Thank you.
Yes.
Right, so if we have 195 times 3, clear, 195
10
times
hours, well, a little over 10 hours.
divided by 60 equals
Bye, Kathy.
9.75. Oh, boy.
Oh, boy.
All
Yep.
right. All right,
Thank you.
guys. Thank you very much for everything that you do. Appreciate it.
You too.
Thank you, everyone. Good night.
Good night.